Ministry of Health of the Republic of Kenya is committed to strengthening social accountability to improve quality of health services through the implementation of a tool called the Community Scorecard.
As a ministry, the reason why we are implementing the Community Scorecard is that for us, I work in the Department of Primary Health Care. And one of the ideals in primary health care is participation. Like, we need people to participate in the delivery of health care. And participation is not just for the sake of participation. We want to ensure that people are getting quality services, so we empower them to be able to have a say. For example, they don't just go to the facility and they get any kind of service and they're just okay. We want them to understand what is a quality service. So when they go to the facility, they can be able, the Community Scorecard is a structured way for them to be able to tell the providers, the service providers, of the level of quality they are giving to them. But in addition to that, it also helps the service providers themselves to improve in terms of service delivery to the citizens.
The Community Scorecard, or CSC, is a community-led governance tool which brings together primary health facilities, local government structures and the community to promote action, accountability and responsiveness to community needs.
This is actually something that is new in the country. It is being introduced, whereby we want to be assessed by the community on what kind of services we are offering to them. We gauge ourselves and then we are able to identify them, to bridge the gaps that are identified through the community responses.
This scorecard can be used to gather service user feedback on the quality of health services provided.
For us to do that, we have identified areas that, if well addressed, will then result into two things: improved quality of health services and also improved demand for these services.
The information obtained helps to improve communication between communities, local leaders and service providers.
There always seems to be a conflict between the consumers of the service, who are the patients, and the health workers. There always seems to be conflict. They say the health workers are not doing their job well, or the health workers may also have other complaints about the patients themselves. So we are hoping that once we start implementing this Community Scorecard, there's more ownership, there's more participation, there's more shared responsibility in the delivery of health services. But beyond that, ultimately why we engage ourselves in these things is because we want to see an improved health outcomes.
The Community Scorecard will empower community members to take action to improve health outcomes when the assessment reveals issues that need to be addressed.
Sometimes unaweza angalia muone kweli hii hospitali yetu kuna kitu inahitaji. Na hiyo sisi tunaweza. Tutaita wanakijiji wale wako na uwezo wa kuja hapa. Tuwaambie sasa hapa tunataka kujenga kitu ya 50,000.
The Community Scorecard involves understanding, measuring and responding to the community's perceptions and needs. The development of the Community Scorecard initiative was a collaborative effort involving various stakeholders. This video is a training tool for the Community Scorecard. It explains the process and the procedures of implementing the scorecard at different levels of healthcare service delivery. Session 1. Background of the Community Scorecard. Session Objectives. At the end of the session, participants should be able to 1. Define the Community Scorecard. 2. Describe the Community Scorecard's purpose and objectives. 3. Explain the rationale for mainstreaming the Community Scorecard into the health sector. 4. Outline the principles of the Community Scorecard.
It's a game changer. It will be a game changer in the way we are going to offer our health services to the community.
Session outline. 1. Social accountability. 2. Community scorecard. 3. Community scorecard purpose and objectives. 4. Rationale for community scorecard guidelines. 5. Mainstreaming community scorecard in health sector. 6. Principles of community scorecard. 7. Conditions for the community scorecard process.
This is a tool that will help us a lot in improving the healthy care of our people, because our main objective is to have a healthy community. And due to healthy scorecard, we are in a position to know what the community needs from us. Where are we doing well so that we can maintain?
What is social accountability? Accountability is the obligation of power holders to take responsibility and be answerable for their actions. Social accountability refers to strategies that employ information and participation of people to demand fairer, more effective public services responsive to the people. Kenya Community Health Strategy 2020 to 2025 advocates for institutionalizing of social accountability in quality of primary health care services.
In health, social accountability then means that healthcare providers should be held accountable to the quality of services that they provide to the clients or population that they serve.
What is a community scorecard? A community scorecard is a citizen-driven accountability tool that enhances civic involvement in delivery of quality health services. It gathers feedback from users of health services and improves communication between communities, local leaders, and service providers. It strengthens social accountability systems by engaging citizens in overseeing government and private sector conduct in delivery of quality health services. It convenes community members, health workers, and local governments to respond to community needs in the health system. It is a powerful tool that puts community at the center of delivery of quality health services, mobilizes community resources, builds trust between service providers and clients, and enhances community ownership and participation.
The scorecard is a self-awareness mechanism. It's only a fool who will not appreciate the role of this scorecard. When you have the scorecard, it's a mirror. You see where you are going wrong. Then you go and do the right thing in the right way. Such that now we have identified, we have a gap in staffing. We have no option but to bring in fresh blood. We get the new staffs. If it is ambulance services, we have no option but to ensure in our budgeting cycle we have money meant for ambulance.
Purpose and objectives of the community scorecard. Promote community ownership and participation to ensure provision of quality health services. Empower communities to take active part in monitoring quality and coverage of health services provided in primary health facilities. Provide structured feedback to health authorities.
Tunaenda tunawauliza maswali kama community health committee, na hiyo maswali tunakuja naye tunakuja na result ya hiyo maswali, tunaletea facility na tunasolve mambo kulingana na mpango ile imewekwa.
Objectives of the community scorecard. 1. Provide an opportunity for community members to evaluate the quality of health services that they receive at the primary health facility and community level. 2. Enable facility and community service providers to understand and appreciate health outcomes in their communities. 3. Promote ownership in communities towards quality health service provision. 4. Enable policymakers to accommodate community needs for relevant resource allocation.
It is a game changer. It has encouraged us more, even more, and it has opened our eyes, and here I mean the eyes of the government, to undertake those basics so that our people get the best. And in the future, we need these more forums, such that even our people, the consumer of our services, they are aware of what ought to happen.
Integrating community scorecard in the health sector. Community scorecard leverages on existing primary healthcare structures, level 1 to 4, including the Community Health Committee, CHC, the Health Facility Management Committee, HFMC, Community Dialogue Days, Community Action Days, the Community Health Action Plan, CHAP, and data review meetings, among others. CHCs will be the key structure implementing the Community Scorecard in Kenya. Community Scorecard shall be digitized and linked to the Kenya Health Information System, KHIS, will be anchored on the ECHIS platform within the wider digital health platform DHP.
Sasa tunaenda mambo ya ruwaza kutokana na HC. Community scorecard itasaidia sana ili kwamba tuwe na huduma bora hata tukiwa na ruwaza health coverage. Tutue ile tunaendelea kupata huduma za kiafya. Na tukishafanya community scorecard, haitakuwa tu maoni ya wanakijiji, lakini tutaifanya kabisa ingie kwa ile mtandao wa afya inaitwa Kenya Health Information System. Ikiingia pale sasa inaweza onekana Kenya mzima. Sanati yenu katika zile njia 9 ambazo tutakuwa tunazifanya.
Principles of the Community Scorecard. Guided by 6 principles, namely: 1. Participation. Community members from all socio-economic backgrounds should be involved. 2. Transparency. Openly share and receive feedback on how health services are being experienced by community members. 3. Accountability. All stakeholders are held to account for the commitments they make. 4. Informed decision making. The stakeholders make decisions based on data and evidence generated. 5. Responsibility. The stakeholders shall be responsible for following through the action plans to ensure continuous improvement of the quality of services. 6. Confidentiality. The information provided by community members will be anonymous and will not be used to victimize anybody.
Tena msisahau kuambia kuwa yale mtazungumzia hapa yatapaki hapa. Hakuna mtu atayatoa nje, na wao wenyewe muambie nao wasienda kuongea. Na ikiwa wataenda kuongea pale vichichini, wasiwe wanaongea na majina ya watu. Waongee sisi tulienda pale tukaongea hivi kama sisi zote. Wasiseme ni fulani fulani alisema hivi. Wasiende na majina ya watu kuongea pale kichichini. Na nyinyi muhakikishie yale yote watawaambia mtayachukulia na mtaenda kusema nani alisema nini.
Session 2. Community Scorecard Process. Session Objective. At the end of the session, participants shall be able to: 1. Explain how the community scorecard indicators were developed and how the community scorecard will be scaled up across Kenya. 2. Explain the meeting conditions for the scorecard process. 3. Explain the community scorecard quarterly process. Session outline. 1. Background on developing the community scorecard and how the community scorecard will be scaled up. 2. Community scorecard quarterly process, scoring and action planning. 3. Community scorecard implementation steps. Background on community scorecard development. The development of the community scorecard was led by the Ministry of Health with support from ALMA and other development partners. The process involved consulting stakeholders to gauge which indicators will best capture important aspects of quality of care in primary health facilities and at community level.
So pale tunaenda tunauliza wanakijiji kama wamefurahia na zile huduma, watasema la ama watasema kweli ndio tunafurahia. Na kama hawajafurahia watatuambia ni nini hawajafurahia. Shida iko wapi? Ukishapata shida iko wapi, tunarudi tena kwa kituo cha afya. Tunaketi na daktari na wenzake na Health Facility Management Committee, tunajadiliana tufanye nini. Wanakijiji wamesema hivi na hivi na hivi na hivi. Tufanye nini tuwasaidie ili waweze kuja kupata huduma.
Understanding the community's perceptions and developing indicators. Wide consultations with stakeholders resulting to a list of 9 indicators below. Indicator 1. Respectful and compassionate care. Indicator 2. Waiting time for provision of healthcare services. Indicator 3. Availability of medicine and diagnostic services. Indicator 4. Responsiveness to community health needs. Indicator 5. Cleanliness of the facility. Indicator 6. Safety and security of the facility. Indicator 7. Home visits by health workers or community health volunteers. Indicator 8. Assessment of NHIF services. Indicator 9. Emergency and referral services.
The scorecard has to be so simple that the community health workers can be able to use it and be able to understand it. Otherwise, if you make it very complex, then it becomes a very academic document. So we have tried as much as possible.
How will the community scorecard be scaled up and implemented across Kenya? 1. The Ministry of Health's Department of Community Health will train county and sub-county health management teams. 2. County Health Management Team and the Sub-County Health Management Team will train the CHS, HFMCs and CHCs. They will use the CSC feedback to guide government action and the health facility supervisions. 3. CHS and CHCs and local administration will be the main implementers of the quarterly process at community level. They will receive training on the community scorecard indicators, how to conduct the indicator scoring assessment and action planning process.
They have taken us through the steps. From today's training, they are training the CHMT, that is the county reform management. Then they will go to the sub-county, and then they will go to the community reform. So the whole of this week, tomorrow I think they will be in Kipipiri, and then they will go down to the community doing the trainings, and then the real activity will begin.
The community scorecard quarterly process is implemented by the community and link facility and can be summarized into 4 parts. 1. Scoring. This is where the community votes to score 9 indicators on the quality of health services. 2. Facility visit and feedback. This is where CHC assessment teams visit facility to discuss community scores and develop draft action plan. 3. Facility community interface meeting. This is done during community dialogue days. The meeting validates and adopts the draft action plan with any necessary modifications. 4. Action implementations and monitoring. This is where actions are implemented during action days and monitored at all levels. Conditions for the community scorecard scoring session. The session should comprise the assessment team that includes 1. The CHC chairperson or acting chairperson. 2. CHC members. At least 3 CHC members. 3. At least 20 community members with representation from youths, people living with disability and the elderly. The 2/3 gender rule should also apply. The meeting should be held in a neutral place such as a school, church, or mosque. The meeting should be predicated upon functional community and facility health management structures. The meeting should not include the CHA, CHVs, facility staff or facility management team members. We will now review the quarterly process in more detail. Step 1. Conducting community scorecard scoring assessment. The community scorecard process is a quarterly activity done during community dialogue meetings. Assessment to be done in 3 phases, namely 1. Phase 1, which is the introduction. Phase 2, which is the purpose of the community scorecard assessment. Phase 3, which is the community scorecard assessment scoring process. Phase 1. Introduction of community scorecard. 1. The CHC assessment team, comprising of CHC chair or deputy, and 3 members will appoint facilitators from among themselves to lead the process. 2. The facilitator informs community members of the importance of the community scorecard, highlighting that it is a way to make health services better in the community. 3. Assures community that the responses received will be anonymous and will not be used for punitive measures but rather to improve service delivery. 4. Explain that the process will help identify the priority areas and give recommendations. Phase 2. Purpose of the community scorecard assessment. The facilitator explains objectives of the community scorecard assessment, which are 1. Capture community perceptions on healthcare services guided by the indicators. 2. Monitor service quality and respond to community needs through generation of action plans. 3. Enable community workers and community members to understand and relay community needs and perceptions. 4. Reinforce action and accountability of primary healthcare delivery system.
Sasa kutoka hapo kila mtu achukue jukumu lake. Kila mtu achukue ile action iko kwa kwake, alafu tu implement. Tukutane after 3 months tuulizane tumefika wapi? Tuko sawa.
Phase 3. The community scorecard assessment process. The facilitator explains. 1. They will discuss 9 indicators to assess the experience with healthcare delivery at their facility and in the community. 2. Each indicator will receive a scorecard of 1 to 3, where 1 is bad, 2 is average, and 3 is good. Facilitators will use Table 1 to guide discussion for 5 to 10 minutes on each indicator. Each score, 1, 2 and 3 is voted on, and the score that receives a majority vote is assigned to the indicator. The score is entered in Form A3. The community should also record reasons or comments for why they assigned the score. 4. The facilitator summarizes discussion and ensures all scores are recorded for each indicator on Form A. Step 2. Facility visit and feedback. After the scoring, the community scorecard assessment team visit the health facility within a week of the scoring assessment. The facility in charge takes the community scorecard assessment team on a tour of the facility so that the team is familiar with the infrastructure and availability of equipment, supplies, medicines, and services. The community scorecard assessment team presents the scores and explanations for the scores to the facility health management team. The community scorecard assessment team and the facility health management team discuss the scores and use the Form B to draw proposed joint action with clear timelines and responsible persons to address the issues identified by the community. The action plan is not final until it is validated by the community. Progress made on the previous quarter's action plan should also be discussed, and any bottlenecks should be noted and addressed. Step 3. Facility Community Interface Meeting. During community dialogue days, the sub-county community health focal person or the public health committee coordinator convenes community members, facility in charge, Health Facility Management Committee, Community Health Committee, Community Health Assistant, Community Health Volunteers, local administration and political leaders, Chair of the Health Facility Management Committee or the CHC lead discussions with community members by presenting the proposed action plan. The community members make changes to the action plan, then validates and adopts. The previous quarter's action plans is also discussed and any items requiring follow-up addressed. 3 copies of the action plans are shared as follows. 1. Copy submitted to SCMOH for follow-up or action. Copy given to the facility in charge to be posted at the facility, and the action entered to the RAMCA scorecard platform. Action items from the previous quarter's action plan should also be updated. 3. Copy given to the Community Health Committee Chair. Step 4. Taking action and monitoring. Community health services focal person at the county and sub-county level, facility in charge, and community health assistant conduct monthly follow-up on the actions. SCMOH responsible for implementation of the action plan at the sub-county level. Community health assistant and facility in charge takes the lead in following up implementation of the action plans at the community and facility level respectively. Community health assistant to leverage the action days to implement the community actions. Progress to be shared in the monthly review meetings at the respective levels.
This one will be very, very comprehensive. It will be a very comprehensive survey because it's a kind of a survey on really how do the community take us. Sometimes we feel that they don't appreciate, but we might be surprised that the community is appreciating our services. We might have all green, we never know. We might have it all red, and this one will really be able to inform us. And that is why I was saying it's important that we be assessed by everybody as much as possible. Those community units, all of them, let them assess us. so that we get as many inputs as possible, and then we can have many areas of improvement, and then we can improve, and we can move towards any red or any yellow towards green.
Session 3. Description of the community scorecard indicators and scoring form. Participants' experience on the facilities has been simplified into the following indicators, which get rated into scores where 1 means bad and is indicated by red, 2 means average and it is indicated by yellow, and 3 means good, which is indicated by green. After discussing the indicators for 5 to 10 minutes, each indicator is assigned a score of 1, 2 or 3 according to the majority vote.
Umuhimu wake ni kuwa itaboresha huduma unapata kwa zahanati. Itaboreshaje huduma? Itaboresha huduma kwa sababu hii wenyewe tutapeana maoni. Ni nini hamjafurahia wakati mnaenda pale? Ni nini haifanyiki vizuri? Ni nini mnataka ibadilishwe? Na wale wahudumu pale na Health Facility Management Committee na hawa wengi wa kijiji Community Health Committee wataketi pamoja, watajadiliane, waone vile watasaidia.
Indicator 1. Respectful and compassionate care. The facilitator will probe if 1. Patients feel respected by health workers when they attend to them. 2. Health workers take time to explain to them their conditions and what they need to do. 3. Health workers pay attention to their concerns. 4. Healthcare workers serve them in private space. 5. Health workers keep information received confidential. That is, do not disclose to third parties. Indicator 2. Waiting time for provision of healthcare services. The facilitator will probe if they are served within reasonable time as provided by the service charter. Indicator 3. Availability of medicines and diagnostic services. The facilitator will probe if 1. They normally get prescribed medicines from the health facility. 2. They normally get the prescribed laboratory tests from the health facility. Indicator 4. Responsiveness to community health needs. The facilitator will probe if 1. Facility staff participate actively in community dialogue meetings. 2. Facility staff respond promptly to community grievances. 3. Facility staff respond to community scorecard action points. Indicator 5. Cleanliness of the facility. The facilitator will probe if 1. The facility has running water. 2. The facility has clean toilets. 3. The facility has hand washing stations with soap and running water. 4. Facility surfaces, floors, windows and doors, ceiling, walls and compounds are kept clean. Indicator 6. Safety and security of the facility. The facilitator will probe if 1. Facility and its environments are free from medical waste, that is, used gloves, face masks, syringes, needles, bandages, and etc. 2. There are separate toilets for both men and women with lockable doors. 3. They have missed health service because electricity was not available at the health facility. 4. There are security guards at the facility during the day and night. 5. There is overgrown grass or bush within the facility compound. Indicator 7. Home visits by health workers or community health volunteers. The facilitator will probe if 1. They receive home visits from community health volunteers at least once in 3 months. 2. They receive any health services from the community health volunteers whenever they visit their homes and request them to explain the nature of the service they receive. Indicator 8. Assessment of NHIF services. The facilitator will probe if 1. Health facility accepts their NHIF cards. 2. They access health services, that is, consultation, laboratory tests, and medicines with the NHIF card at the health facility. Indicator 9. Emergency and referral services. The facilitator will probe if 1. They normally get ambulance services promptly, that is, from the county health department, whenever they have a medical emergency. 2. They are referred by the community health volunteer from the community to the health facility for further management of their conditions. 3. They are referred from the health facility to the community for the continuity of care at home. 4. The referrals from the community by the community health volunteers are honored by the link facility.
Is the environment safe? Is it safe? Is it secure for them? Are there, for example, overgrown grass? Is the facility littered? Those are things that put off communities from using our facilities.
Kama CHV kuacha kwako uende ukaangalia wengine na hakuna ile stipend ama ile kitu inakupea motisha ya kufanya hiyo kazi, inakuanga ni tisho kubwa, na wengi wameacha hii kazi juu huwezi acha mtoto wako kama analala njaa uende ukashughulikie wengine.
The other area of interest is whether they have they benefit from NHIF services, and so it's one thing to enroll for NHIF, but it's another thing to also receive the service that you need using your NHIF card. So we'll be asking them whether they're able to get the service they need to get using NHIF card. And then finally, it's about emergency services. Do they access ambulance services whenever there's an emergency? So we are thinking if we addressed all those areas, we are likely to have improved quality of health services in this country, and we're also likely to have a high demand for our health services in this country. So in a nutshell, that's what we are working on using community scorecard approach.
Session 4. Community Action Planning. Session Objectives. By the end of this session, participants will know how to 1. Prioritize identified problems. 2. Identify the cause of a problem. 3. Create a community scorecard action plan. What is an action plan? An action plan is planned activities to solve problems identified by community members. The community scorecard assessment team and the health facility management team prepares the draft action plan, which are thereafter validated and adopted by the community. Review of previous quarter's action plan. Before creating new action plan, Health Facility Management Committee Chairperson should review the progress made on previous quarter's action plan items by A. Identifying all achieved actions. B. Noting actions that require attention or additional support from the higher levels. C. Updating the status of the progress of the action plans in the scorecard platform. On the same, to celebrate and announce the completion of previous actions. After reviewing the previous action plan, you'll be ready to develop a new action plan, but first, it is important to prioritize the issues. The Health Facility Management Chairperson should help the team to identify at least 3 priorities from Form A. The priorities should be the indicators that receive the lowest scores, that is, scored 1. If it is not clear what to prioritize, it is recommended to prioritize the indicators that receive the most negative votes. The Secretary writes the priority problems in the first column of Form B.
You might get that we have rated maybe 5 indicators as poor. So 5 indicators in the scorecard are not doing well. So should we take all the 5 indicators in the scorecard and then act on them? Probably no, because it may be overwhelming for you to take a big number of indicators to analyze and try to find solutions for them. So we always recommend that at least identify 3 priorities, 3 indicators that are not doing very well. Of the 5, only identify 3. And these are the ones you zero in and do what? And find solutions and develop an action on those 3 indicators. So how do you identify 3 indicators out of 5? Very simple. Look at the indicators with the lowest score.
The chair asks, why does this problem exist? How long has this been a problem? Is this a problem the community can solve with community resources? Is this a problem that requires the intervention of the sub-county, county or national government? Then, the Secretary writes the potential causes of the problem.
For example, issues of staffing. If you realize the problem is you don't have enough staff in that facility, maybe that's why when the community members come, they stay long in the community, then that's not a problem you can deal with as a facility, isn't it? That's a problem you might need to escalate to the director. And say, director, in this facility, we are supposed to have 5 staff members, but we only have 1. And that one is overwhelmed. And because of that, when community members come to seek for services, they wait for all day before they get service. And they're already complaining about that. They're not happy staying in the facility for a whole day. Then ask also, how long has this been a problem?
What should be done? The chair guides the action planning discussion using these questions. What action to take? Who will carry it out? When will it take place and for how long? What resources are needed? Who is responsible for coordinating and reporting the progress? The Secretary then completes the remaining fields in the Form B using answers from the questions in this slide. Session 5. Role Play Exercise. Activity, Scoring and Action Planning. 1. Divide participants into groups of 5 to 10 people. 2. Each group should have 1 copy of Form A and B. 3. Select 1 chair and 1 secretary. 4. Using the Community Scorecard Guide, the chair should 1. Facilitate a community scorecard scoring session, at least 3 indicators. 2. Facilitate an action planning session. The Secretary should record deliberations on Form A and Form B. Session 6. Community Scorecard Data Flow. Community Scorecard Data Flow and Review Process. duly filled Form A will be entered by the Sub-County Health Records Information Officer into Kenya Health Information System 2, whereas Form B will be entered into the scorecard platform www.ramcar.org. The scorecard platform will produce the community scorecard that allows for disaggregated and granulated visualization of data for different hierarchical units, national, county and sub-county, and etc. All stakeholders will be assigned a username and password to enable them access and use the platform. Training on the scorecard platform will be part of the community scorecard rollout plan. The scorecard to be integrated into existing performance review processes. At facility and community levels, the scorecard will be used to track implementation of actions. At other levels, it will be reviewed, bottlenecks identified, and actions taken to improve quality of health services.
We have a tool, finally, that is going to be telling the country on a more regular basis about the kind of services. It's like we are measuring ourselves against some standards, yeah? So that it's not just the standards we set for ourselves, but it's also the people out there, what are they saying about our services, and how can we, based on the feedback they give us, improve the delivery of those services. And ultimately, as the health sector, what we want to see is better health for everybody.